At what age do they experience menopause?
Mm-hmm.
And is there any vitamins or anything you could recommend to manage any discomfort? So age and
Age.
managing.
The average age for menopause, depending on the literature that you read, is about 51 to 52 years of age. However, depending on the particular woman that you're dealing with, the particular patient that you're dealing with, this could be a few years, 2 to 3 years earlier or 2 to 3 years later. Okay, but the average age is about 51 or 52 years of age, depending on the literature. Now, we must differentiate between menopause and the perimenopause. Okay, menopause is when the menstrual cycles cease. When the menstrual cycles stop and the woman is no longer able to become pregnant, she loses her reproductive capacity. That is menopause. Now, typically, if menopause happens today, 2 to 3 years before, there is a transition period that is called the climacteric or perimenopause. Now, that transition period is what women really speak about when they say that, they're going through menopause and they have all these troublesome symptoms. Okay, so you may find that during that period, during that perimenopause, the woman develops quite a number of annoying symptoms. She may develop headaches, she may develop hot flashes, she may develop insomnia, difficulty sleeping. Her periods tend to become very irregular. She may menstruate in January and not have a menstruation until June, and then she has another one, probably in August. It becomes very irregular. She may also have mood swings, which is something that tends to create, quite a lot of marital discord because, especially in our environment, because men don't understand, the symptoms of menopause and so on. So the lady will have quite a number of annoying symptoms during this period. Now, menopause is a natural process. It's an inevitable process, so every woman needs to prepare themselves mentally for it to happen. But typically, we only intervene if the woman has specific issues. If she has very severe hot flashes, there are a number of medications that we can prescribe to control those hot flashes. If the hot flashes are not that severe, then we typically don't intervene. Another problem that she may have, not necessarily in the perimenopause, but once the menopause occurs, once she stops menstruating and she has not menstruated for an entire year, clinically we say, hey, yes, she has entered menopause. Now, one problem going forward from that point is that she's going to lose the minerals in her bone. Okay, so minerals like calcium and so on will be lost from the bone, and the woman tends to, over time, lose some degree of bone mass. That is why, for example, pelvic fractures of the pelvis, are more common in older ladies than in older gentlemen, because after the menopause, the woman tends to lose calcium, she tends to lose some other minerals, calcium, magnesium, and so on, in her bone, and so the bones become more, a bit softer. So, in terms of vitamins and minerals and so on that a lady can use, there are quite a number of formulations nowadays that contain, the right amounts of the minerals and so on that the lady would need after. Centrum Silver is a good one. One a day, 50 plus is another good one that they could use, because these are over-the-counter formulations that have in all of the vitamins and the minerals that they would need specifically for that stage of life.
So in terms of the hormones and the fluctuation in the hormones after 50, someone is asking, how can I maintain my estrogen level? And that person also, 50, speaks of vaginal dryness issue.
Okay, right. Okay, so vaginal dryness, that is another complication that begins during the perimenopausal period. To answer the question about how to maintain hormones, you're not going to maintain the hormones. Naturally, the hormones are going to decrease. After menopause, or from the time the perimenopause begins, there is a drastic or gradual decline in the levels of estrogen, because the ovaries that produce the estrogens are now slowing down. That factory that used to produce the estrogen and progesterone, two of the female hormones, is now shutting down, and there's nothing that you or me or anyone can do to stop that process. So the estrogen will drop. Now, if the lady requires, usually that will not be a requirement, there are synthetic estrogens that we can actually give her in certain situations to maintain her estrogen levels. Okay. Now, I'll give an example. A woman may go into menopause not because she has reached that 50 or 51 year mark. She may go into menopause because we may have had to do an operation and remove her ovaries. For example, we may have a 40-year-old who has maybe a cervical cancer or an endometrial cancer, cancer of the womb. And we may have to actually do a hysterectomy, take the womb out, and we may have to take out both ovaries. That woman has not really reached the age for menopause, but she has had a medically induced menopause because we have had to remove the ovaries. Now, we have had to remove the ovaries for her safety so that the cancer does not spread to those organs. But at the same time, we are left with a dilemma that, now this young lady who's 40 years old now does not have any estrogen. In that case, we give her some medications that are called conjugated estrogens, which are synthetic estrogens that are produced that we can give her. They come in tablet form, sometimes in injection forms, and that way she can maintain her estrogen levels so that she does not suffer those annoying symptoms and the vaginal dryness. For the vaginal dryness, typically we give the same medication, conjugated estrogens, in the form of a cream. So the lady can apply that cream to the vulva, okay, and that will aid with the vaginal secretions. Okay.
So in this case, she should see a doctor for.
Yeah, she should see a gynecologist. If she's suffering from vaginal dryness, she should see a gynecologist so that they can prescribe something adequate for her.
And vaginal dryness, in that sense, present itself during sexual activity, or?
Well, typically it will be noticed during sexual activity. It will be noticed. The woman will notice that during sexual activity, the vagina just doesn't lubricate as much as it used to. She may also notice that on bathing, the skin of the vulva cracks easily. So, she's bathing and she may notice that the skin of the vulva, begins to have small cracks. She may begin to notice, every time I put soap down there, I feel, some tremendous burning. And when she comes for, a checkup and we look there, we notice that, the skin becomes very thin. There's a medical term, atrophic. So it becomes very thin and it, basically splits very, very easily. So we would know, hey, this lady is going through menopause. This is a problem that is happening. She needs some sort of topical estrogen to rehydrate the skin and stimulate her glands in the vagina to begin to secrete, the typical secretions.
So, two other areas, fibroids and menopause. The question specifically, the expectation is that the fibroids may shrink a bit. Should you still consider removing your fibroids and menopause?
Okay, fibroids and menopause. There is a slight misconception that the fibroids shrink after menopause. There may be some slight shrinkage, but what actually happens is that the fibroid stops growing. Okay, it stops growing because fibroids feed on the same hormone, estrogen. Okay, so I often smile when I have a woman in the office in front of me and she's young. She's, let's say, 30, 35. She has some large fibroids, and I tell her, your fibroids are large enough now that you probably need to do a myomectomy to take out the fibroids, or you need to do a hysterectomy and take the entire womb out. And she says, no, give me something to shrink the fibroids, because, we really have nothing to shrink fibroids definitively. Now, what actually happened? The fibroids are feeding on her hormones. So the woman is 35, she's 40, her ovaries are producing estrogen non-stop, and the fibroids are just feeding on that. They're using that as fuel to grow. Now, after menopause, remember, there is a dramatic drop in the estrogen levels, and as a result of that, the fibroids, they basically don't have any more fuel. They basically, so they don't grow anymore. There may be some slight shrinkage, but not a significant reduction. It's not as though you had 2 or 3 large fibroids the size of tennis balls, and after menopause they're just going to disappear, or they're going to shrink to the size of marbles. That's not the case. Okay. Now, whether or not the lady should still seek some sort of surgical intervention for fibroids depends on the size of the fibroids and what symptoms or what problems they're creating. If the fibroids are particularly large and they are creating some sort of problem, perhaps she's having some pain because the fibroids are pressing on, some of the internal organs. Perhaps, she's having some digestive problems because the fibroids are, pushing up on the stomach, etc. Then maybe she should consider actually taking them out. Otherwise, if they're not creating any problem, then she doesn't necessarily have to undergo any surgical intervention for fibroids. Okay.
Thank you. A question of puberty. There's sex drive and then there's puberty. Sorry. Okay. So sex drive. The person said no desire, no sexual desire. Is something wrong? And then they move on to ask about how do you handle stress. I don't know if they put the two together.
So this is a person who is postmenopausal, or
no? I think that person might be in the 30s, 40s.
30s, 40s. Okay. Lack of libido or sex drive is a difficult problem to treat. It's a difficult problem to treat. 90% of the times, the problem is psychological. Okay, the problem is psychological, and a lot of times it is some conflict, for lack of a better term, with the partner. There's some issue with the partner that the person has that is not being resolved or that is not being addressed. Okay, perhaps the person, does not feel comfortable around the partner, and as a result of that, doesn't really feel the urge. Perhaps it's a situation where the person now, for one reason or another, detests the partner, and as a result of that, there is no urge. Other times, it may be that if the lady's really young, we would have to send her for what we call a hormone panel to see what her hormone levels are like. Perhaps the hormones, there are some hormones that are produced by the brainstem that stimulate the ovaries to produce estrogen and progesterone. So we would have to check those hormones to see if those hormones are still okay, if there is some sort of hormone imbalance. Okay, if the lady has reduced levels of estrogen, she may have a reduction in her sex drive or in her libido. But most times it's a psychological issue. There is some reason, particularly with women, there is some reason why she's not happy in the environment that she's in. And as a result of that, that is why the reduction in sex drive occurs.
But it may be different for menopausal women.
It may be different for a menopausal woman. With a menopausal woman, there is a transient reduction in sex drive. Because remember, as I mentioned, during the perimenopause, right, and for even a year or two after menopause, the lady is undergoing a transition in terms of her hormones. There is a dramatic imbalance in her hormones. She is not accustomed to that low level of estrogen. Suddenly, her body is accustomed to a certain level of estrogen, and suddenly the estrogen drops. And that creates a myriad of problems, and it may create a transient drop or temporary drop in her sex drive and her libido. Now, I say transient or temporary because in most women it recurs. It reappears. However, the problem, particularly in our environment, and I stress in the Caribbean, in Antigua and in the wider Caribbean, and perhaps in societies where the population is particularly I don't really want to say this, but of African or descent or black, there is always an issue there because there is some degree of marital discord during that time, because the men are highly uneducated that, this is a process that is going to occur. The lady is going to respond in this way. She's going to have these mood swings. She's going to be happy one moment and sad the next. She's not going to want to talk to you at this particular point in time. Sometimes she may just be angry for no reason. Okay. And our men are not educated that this is a process that is going to occur. And, there may be a period of time, like maybe a year or 2 years, where the woman is just not interested in intercourse. And she just doesn't have the drive for intercourse. But as I said, it will reappear. You just have to give it some time until she's out of this period. The reason why I say it reappears, you see it a lot, even in Hollywood, in movies. The lady's with one person, and she's going through this period, and nothing is happening, and then there's a divorce or separation here. 2-3 years later, she finds somebody else, and then she's the happiest person, and she functions normally, and whatever the case may be. So we just have to remember that for postmenopausal women, it's a transient process. Doesn't necessarily need to be investigated. It's something that is going to occur for a while, and we just need to be patient until she gets across the bridge, so to speak.